Chapter 15, Nervous System. In the first section of the chapter, we'll look at the pronunciation of organs and anatomical structures of the nervous system, and we'll look at defining and spelling word parts related to the nervous system. And we'll also look at defining, pronouncing, and spelling disease and disorder terms, and spelling surgical terms of the nervous system. Looking at the anatomy of the system, essentially there are two parts of the nervous system, the central nervous system and the peripheral nervous system. Within the central nervous system, the brain and spinal cord are included, and in the peripheral nervous system, that's going to include the spinal and cranial nerves, those nerves that branch throughout the body. Looking at the physiology of the function of the system is to detect changes that are from inside the body and that refer to outside of the body, to evaluate information that is transmitted from one part of the body to the brain and back to the body again, and to send directions to muscles and glands. Glands are going to be producing hormones, and muscles, of course, are needed in function of movement. So the brain's going to send directions to those in order for them to begin their function. And then also another function is the mental activities of the body. This is a diagram of the brain and the spinal cord. And if you look at the bottom of the spinal cord, there's a projection there that is called cauda equina. And if you look from the Greek and Latin, that means basically a horse tail. If you look at the appearance, it kind of looks like a hairy tail a horse would look. In this graphic, we see basically a cross-section of the spinal cord and its different parts. You can see the projections of the nerves as it extends off the cord and goes out into to be projected into different parts of the body. And then we have the different layers of the spinal cord. Okay, some combining forms of this system include encephalo, which is brain, and cerebello, which means cerebellum. Meningio and meningio is the meninges, and radiculo and rhizo is nerve root, and myelo is spinal cord. And we also had another term that means myelo, and that was bone marrow. Continuing with combining forms, we have cranio, which means cranium or skull. Mento is mind. Phaso means speech. Quadri, if you notice here we have an I instead of an O. Quadri means four. And thrombo means blood clot. Some prefixes that we would see in this system include AN or AN, and we might also use A as well for that prefix. It means absent of or without. Hemi means half. Inter means between. Post means under. And sub means below or under. Some of the more common suffixes that you would see in the nervous system include seal, which is hernia or protrusion. Ictal, which means seizure or attack. Osis, which is an abnormal condition, and when you see that in relationship to a word part that refers to blood or blood cell, then that would mean an increase of. Paresis means a slight paralysis, and plagia means paralysis. So the difference between these two suffixes means there's a reduction of or a slight or reduction of sensation in paresis, whereas in plagia there would be a paralysis. So let's look at some terms that are built from word parts, and this relates to disease and disorder. We have cerebral thrombosis, and that's basically an abnormal condition of the cerebellum, which includes a blood clot. A glioblastoma is a tumor, and it's made up of glio, or an increased level of glio. It's also of note to know that it is the most common primary cause of tumor of the brain. So primary being the origin or the beginning of the brain of the tumor would be in a glioblastoma. Hydrocephalus. Hydro means waters, but this is a increase of water or fluid, and quite often it's cerebrospinal fluid in the head. Meningeomyelocele. If you look at different types of protrusions, this is one level where the meninges and the spinal cord are protruding through the neural arch of the vertebral column, and it's degrees of that prolapse that are used a lot of times in prolapsing of the spinal cord, or the relaxing of the spinal cord and protrusion. Subdural hematoma. This is happening below the subdural area, and this is quite often going to be referred to as a blood tumor, but it's a collection of blood basically that's caused by blood vessel breaking for whatever reason. It's not uncommon to see these as a result of things like head injuries or auto accidents, sometimes sports accidents, and you could also see them more frequently in elderly patients where maybe they may fall and hit their head. So these are not extremely uncommon, but they are a pretty serious event. Now some terms that were not built from word parts in the disease and disorder area. First, we'll have Alzheimer's disease, and this is the Alzheimer can be pronounced, you hear it pronounced both Alzheimer and Alzheimer. It was the person who defined or kind of discovered the disease last name, so that tells you the origin, but please note, it does not have a T in it. So this is a common mispronunciation of this term, is to pronounce it with a T, and it does not have one. So always make sure you're aware of that difference in pronunciation that you often hear. Bell palsy is the next term, and you hear this referred to quite often as Bell's palsy, but it's paralysis of the muscles of one side of the face, and typically because of an inflammation effect on the facial or cranial nerves. It typically is temporary. In most patients, it only lasts a matter of days or a week or so, and then it's gone. Dementia is a cognitive impairment or loss of intellectual brain function. And of note, it is not a normal process of aging. So this is not just because someone got older. This is a true disorder. Parkinson's disease, and this is a chronic degenerative problem or disease of the nervous system, and you will see this with the development of things like tremors and shaking and those kind of things, and then it progresses on to some other signs and symptoms as well. Transient ischemic attack is a sudden deficient blood supply to the brain. The good thing is this is a temporary condition also, usually does not leave a lot of long-term lasting effect. However, it is considered a warning sign that this person could be at higher risk of actually having a full stroke, in which case there would be residual damage. So let's look at some surgical terms, and these are built from word part. First one is ganglionectomy, and this is the excision of the ganglion, and we see this not uncommonly when someone has a ganglion cyst, that they're painful, uncomfortable, they limit movement, sometimes they affect the nerves and cause some tingling or nerve effect in that area, and so they a lot of times would do this type of procedure. Neurolysis is loosening or separating of a nerve. Neuropathy. This is suturing of a nerve if in a surgical procedure where maybe they're repairing an injury or those kind of things. Sometimes they also need to suture a nerve. Neurotomy, this is incision into a nerve, and rhizotomy is an incision into a nerve as well.